Started. Thanks so much for being here. We're excited to share with you some information about our collaboration in Guatemala between LIXIL, Global Communities, and USAID. So our market study in Guatemala launched in September, just about 3 weeks ago. So we barely made it to have some early insights and data to share with you. So yeah, congrats to ourselves for that effort. Wanted to take a minute just to introduce ourselves. My name is Annie Robinson. I am the acting director of the Partnership for Better Living. I'll explain what that is later, but I am a part of the LIXIL team.
And my name is Jason Brooks. I'm the technical director for Global WASH for Global Communities.
And my name is Gunjan Patel. I am a product design engineer with SATO. I'm based here in the US as well.
And Mark, if you can hear us, you introduce yourself.
Can you hear me? I'm Mark Valentine. I'm the country director of Global Communities in Guatemala. It's nice to be joining you virtually.
Great. Thanks, Mark. Well, we have a little bit of a surprise twist to the session. Before we really get into the details of the market study, we are going to test your knowledge of Guatemala and do a quick Kahoot quiz. So get ready. So, yep, hit start. So I don't know if you're familiar with how to do this, but the QR code will come up on the screen. If you can take a quick snapshot of that, that will take you to this Kahoot quiz where you enter that PIN and you set up a name, a username, and then hopefully that will link you to this Kahoot quiz. If you click on the QR code, it'll make it bigger. It is coming from that, yeah.
Player limit reached.
What'd you say?
It says player limit reached.
Oh, okay. Okay, well, if you didn't make the cut, you can play along and keep track of your points, and we all get the prize, which is candy at the end anyhow, so. Okay, all right.
Ready?
Here we go, yep.
And this is timed. You get points for being quick with an answer and also for being correct. So
That's right, 20 seconds. Does anybody get it right?
Sure.
20, 25, we got 2 people.
only two.
2 people got it right, congrats.
Pretty even spread across the losers.
Many people equally wrong.
It's a learning session, we won't call anybody a loser.
Bless you. All right, ready for the next one?
Yeah, there's 10 questions.
There's a scoreboard. Andy and Sam, good job.
Andy, take a bow.
All right, next question. Which of these is Guatemala credited with inventing? Corn chips, chocolate bars, denim, or ground coffee?
I like it, impromptu game show host.
Something wants to know. And the answer is, what is it? Chocolate bar.
Chocolate bar.
Yes. Oh, another 2 people got it right. Let's see what the scores are now. Andy's still in the lead.
Who's Andy?
Who is Andy?
Thanks for it.
All right.
Are you from Guatemala?
That would be cheating.
Colombia. All right. Question 3. How do Guatemalans honor their dead? Is it planting orange flowers, sacrificing animals, eating some fish, or flying kites? seconds. The answer is flying kites. No, Andy.
Andy.
You're too close to Guatemala. Question 4. What is a quetzal? Is it Guatemala's national bird, their monetary unit, both, or neither? The answer is both, their national bird and their currency. Assuming Andy got it.
Oh,
Carlos.
that's you, yeah.
Question 5, is it true or false? Guatemala is the most populous country in Central America. The answer is true.
Okay.
Oh, it's a
Oh.
big shift in the leaderboard now.
That's you.
All right.
Chris.
And I know nothing about Guatemala.
Good guess.
And then, oops, come on. All right, question 6. Guatemala is one of the world's largest producers of what? Jade, coal, rice, or diamonds? And Guatemala is the largest producer of jade. Good amount of you got it right.
Guess it's my time, right? Well, that's good.
All right, next question. Oh, Krista, what is the word for toilet in Spanish? Inodoro, sanitario, latrina, all of the above. All of the above. There are no
Get
changes.
it right? No.
Crystal in the lead. All right, question 8, true or false? In rural Guatemala, 42% don't have access to basic sanitation. And unfortunately, it is true. Is this the last one? Oh, question 9.
2 more.
What do you hope to hear the panelists speak about today? How this public-private partnership was formed, the challenges and lessons learned, early insights from the market study, how the food is in Guatemala.
It's a trick question.
This is a little bit of a trick question. You're right. I was just guessing how you would answer it.
All right. Ooh,
Oh,
Jay.
it's Jay.
All right, last question. How would you expect our panelists to describe the experience of launching a market study in Guatemala? Exciting, challenging, rewarding, all of the above.
Also, probably a loaded question.
I think we only have 90.
I know.
So let's skip it.
It's kind of,
Or, all right, everyone got that one. Whoa, whoa,
okay, who wins? The big prize.
whoa. Jay. Oh no, that's third place. Carlos in second.
And
Chris.
Chris, well done.
Good job.
Thanks, everybody, for humoring us. That would be kind of a fun start in the afternoon lull. As a reward for participation, we do have a SATO pan full of candy in the front here. I was going to put the candy directly in the SATO pan, but I was told the public health officials would not approve of that. So
Don't worry, it's never been used.
nobody's used it. Correct. Let me, I guess, stand up here. So how do we just hit the?
Just hit the right arrows.
Okay. So, again, we're really excited to share with you the 2-year journey of how we've gotten here between USAID, Global Communities, and LIXIL. So I kind of wanted to start with a little bit of a background of all the players in the room here. We get this question a lot. Who is SATO? Who is LIXIL? Is it the same? Are they different? So SATO is a brand of LIXIL. LIXIL is a multinational corporation based in Japan. And with SATO as one of our brands, another very popular brand and well-known brand is American Standard. So the mission and purpose of SATO is to empower people everywhere to live a better life through innovative and affordable sanitation and hygiene solutions. LIXIL as a company has set an ambitious goal for us to improve the lives of at least 100 million people by 2025. LIXIL is certainly pleased to report, this was announced in June of this year, that in the past 12 years, we have reached 68 million people with improved sanitation and hygiene. It's notable that the number that was reported 18 months ago was 45 million. So really notable to notice how it's accelerated so quickly over just the past 18 months. SATO from Gunjan from our product development team, he also goes by SATO. He's gonna walk us through our portfolio a little bit.
Yeah, just a quick kind of introduction to some of our products. So just a little bit of history. So we launched our first product in 2013 in Bangladesh, which was the latrine pan that you see there. Now, the first picture of the SATO is actually the 101, but this is a different variation. But what we pride ourselves in with this product is the ability to create a cheap, affordable product that can use minimal water, especially if you're in an area that has a lot of water scarcity or you have to walk very far to get your washing water. So we use that as a basis of our what we call an engine for the latrine systems, which is the trapdoor that you see in the bottom of the pan. The trapdoor is an automatically closing or self-closing feature. Right after you flush it, the user doesn't have to do anything because of the counter weight. It'll automatically close, create a water seal with a little bit of water that's left over from your flush, and keep out any insects or harmful pathogens from entering the human environment. So we use that as a basis to create some of our other products that you can see here. We have a stool. We have what we call an Arista style pan. We have these two, which is an I-trap and a V-trap, which is used for offset pit systems, or in this case, the V-trap is used for an offset twin pit system. And then we have other, our new slab products, which you can bundle with different, like a pan or a stool, and bundle it with either the I-trap or V-trap as well. We have a number of other products as well. We just launched the pit liner. So we have products that encapsulate the entire latrine structure and system. So it's a one-stop shop for anything that you need regarding a pit latrine.
I love to say what it's launching next week.
Not yet.
There's a new product being launched next week.
Yes. We can't talk about it, but should be on the lookout.
Stay tuned.
So, just like Annie said, LIXIL is a company with a number of brands, including American Standard. So we leverage our experience. We leverage our experience in the sanitation and hygiene industry to create our SATO products. One of the benefits is that we focus a lot on user experience and interface with the users. So we do a lot of ergonomic studies, we do a lot of market research, we do a lot of interviews with users even before and after testing products with them. So one of the benefits, just one of the examples that you can see here, is this before and after picture of a latrine. You can see the before was, just a hole in the ground. the children were especially scared of using any sort of latrines like this because they were afraid of falling into it. So we took that into account to make sure any of our systems had a closed bottom so that the children don't see what's inside, they feel safe using it. So that was one of the initial thoughts of creating our trapdoor system. And you can see here, we replaced one of these holes with our SATO pan and another one with a stool, depending on if you have a squatting culture or a sitting culture in your region. Next.
Yeah. Thanks. So, as many of you may be working on USAID projects, USAID projects have been working with SATO products for many years in many countries. This kind of highlights several, but there's dozens more really. So these collaborations were happening at the project level, which is great. Some notable efforts here: T-Wash, the Transform Wash project in Ethiopia, sold over 168,000 units, and some other close seconds in Uganda, selling 77,000 as an example. So, USAID and LIXIL started having some conversations probably around 2020 and thinking more about, well, this is amazing and a great effort. I wonder what we could do to support this more. What can we do to enhance this, accelerate the efforts and the great collaboration we're seeing at the project level? So really trying to ask some questions. What would additional support look like? What opportunities have we potentially missed? So, as I kind of alluded to before, I would explain about Partnership for Better Living later. That's now. So USAID and LIXIL kind of dreamed of this Partnership for Better Living, public-private partnership with the intention and target of reaching an additional 2 million people by 2026. So, the three primary objectives of our Partnership for Better Living is to expand the market and increase demand for sanitation and hygiene solutions, to improve the availability and really think through how we can support the supply chain, and to strengthen the business and enabling environment for improved access to sanitation and hygiene. So PBL really works at the overlap of USAID priority countries, WASH priority countries, and new markets or relatively new markets for LIXIL. So that funnels us down to our 5 primary countries that we focus on right now. We just stepped foot into year 4 of our 5-year project with strong focus in Guatemala, Liberia, Madagascar, Philippines, and Senegal. So that is what brought us to the table to start engaging with the USAID project in Guatemala, led by Global Communities. I'll hand it over to Jason.
Yeah, and these guys are great to work with, and they insisted I take an opportunity to just tell a little bit about Global Communities. And then also our country director from Guatemala will talk a little bit about the Integrating WASH project in Guatemala and how we came to be connected with SATO. Oh, sorry, I wasn't paying attention. So, Global Communities is an international NGO that works in over 30 countries and also has the IntraHealth and Vitas Investment Group brands. I should really do that myself, shouldn't I? Sorry, that's lazy. And we work in a number of different areas: humanitarian assistance, financial inclusion, and sustainable development, of course, including water security, sanitation, and hygiene. And this is just a map highlighting some of the countries where we work. And more interestingly, to talk about a specific project, I'd like to invite Mark Valentine, our country director from Guatemala, who can talk a little bit about Integrating WASH, our USAID-funded water sanitation and hygiene program in Guatemala, and also about how the relationship with SATO started.
Thanks, Jason. Just to give you a brief background on iWash, it's a water and sanitation program funded by USAID and implemented by Global Communities that contributes to improved health and nutrition outcomes in the 18 municipalities of the Huehuetenango and Quiché departments in Guatemala, which are shown in the slide here. through the expansion of integrated and high-quality wash and water resources management services. It is designed to improve the wash system in Guatemala and reduce inequality in access to safe water and improve sanitation in rural communities where access is most limited. I think you can switch to the next slide, which kind of illustrates how iWash's integrated approach uses 4 complementary components. The first one focuses on governance, improving wash governance at the central, municipal, and community levels by increasing coordination, improving policies, and trying to promote a more efficient public financing to address priority wash and WRM needs. The second component mobilizes and grows an inclusive wash workforce. We try to promote opportunities for Indigenous women and youth to enter that workforce and professionalize the wash sector through institutional strengthening for service providers and other relevant actors. The third component is where the rubber hits the road, really, and we improve wash and WRM quality along the full service ladder with a strong focus on data-driven solutions that allow us to learn and adapt during program implementation. There's also a component of social behavior change around improved sanitation behaviors in the third component. But it's really the fourth component where our work with LIXIL comes into play. The fourth component uses a market systems approach to extend the wash and WM market to rural communities. We do that by creating sustainable and innovative incentives for the private sector to really invest in rural markets and also mobilize funding from the financial sector for rural water and sanitation projects. As a kind of cross-cutting focus in the design and implementation of our activities, as we do with all of our programs in global communities, we work with and from the communities. And specifically in iWash, we really promote the participation of Indigenous women and youth in WASH decision-making spaces at the community level and ensure that the program incorporates the Mayan cosmovision and perspectives around water resources management, which are quite culturally specific, and include the priorities of rural Indigenous communities in our activities. That's the 2-minute summary of iWash, and I think I'll hand it back to Annie.
Thank you, Mark. Okay, so I would say this journey began for all of us about 2 years ago when we first learned of the iWash project kicking off. I think iWash project is currently in year 3. So we began these conversations quite early, which is ideal to think through what this market study is and what we want to accomplish and how we can collaborate. So certainly an important step. Step 1 is really trying to think about what all the actors are looking for. What's the goal? What are we trying to accomplish together? So the goal from the LIXIL and SATO perspective is certainly to understand if there's a product market fit. We worked very closely with the iWash team to think through this, and they helped identify the products that they felt were most compelling and aspirational for their local communities. iWash's primary objective is to expand the market with low-cost and desirable sanitation products, and the perspective of USAID is excited to see this collaboration take off in an effort to achieve the national priority of at least 90% access to improved water and sanitation. I was trying to think about if we're able to quantify for you how long these steps take, because you speak about them so quickly as if it's a simple exercise, but I would say step 1 and step 2 are probably a 6-month venture. And again, looking at this slide that I created, a few days ago, realizing that I probably missed an important step, which is just the sort of, I wouldn't say educational, but the learning component, knowing that the SATO products have never been in Central America before in any kind of concentrated effort. They've certainly been shipped here and there for some disaster response and humanitarian efforts, but never made this kind of concerted effort before to really understand the local market and how we might fit in. So working with the iWash team to really help them understand what SATO products are, what their capabilities are, and help trying to identify what the right products would be. So, that's an important bullet, that's too many words, but, quite a long process. LIXIL shipped 1,000 SATO. I keep turning around. I realize Gunjan gave this to me on purpose. We shipped 1,000 SATO taps, which is our hand washing solution, and 600 SATO stools. They were shipped from Tanzania in late 2023 and arrived early 2024. The shipping component was another learning curve, I would say. So the market study, we were hopeful for it to start a little bit earlier than it did, but it launched just last month with the intention of it being concluded by December of this year. Again, it took a while for all actors to kind of understand and agree on what the activities would really involve. So where we'd be working, what other partners would be supporting. iWash works with their local partners to implement, and there are other partners as well. UNICEF, Helvetas, and Habitat for Humanity are also participating. So they identified the communities in which they would be working, these 4 departments, which is Western rural Guatemala, and identifying kind of the specific roles and responsibilities for those local partners to provide one product, one stool, and one tap to families with the intention of doing a survey at the time of installation and returning just 2 to 4 weeks later to assess their consumer preferences and their user preferences and experience. So again, another important step is really working with iWash to select the products. So I think Gunjan or Sato here will also kind of talk about the specific products that they're testing in Guatemala.
Sure. Okay. So like Annie said, we were testing the SATO tap as well as the SATO stool in Guatemala. Specifically, the SATO stool was chosen as we learned that Guatemala has more of a sitting culture for the latrine use, as opposed to like in Asia, a lot of people like to squat. So that was an easy choice. And then alongside using a latrine, we wanted to provide a hand hygiene or hand washing solution as well. So that's why the tap was chosen. For the stool, I had briefly mentioned it. Let me just grab the stool real quick. So I had briefly mentioned kind of the engine of our SATO products using a trapdoor system. So this one, you can see the counterweight itself is fully plastic. We have a cement version, but we created this fully plastic counterweight primarily for areas that have hard access to, or difficult to access cement or concrete, as well as if they're more up in the mountains or difficult terrain to reach, then this is easier to ship or carry on a truck or even a motorcycle. So originally we designed this around the 2014, 2015 timeframe, and when we initially got the request to create a seated type of latrine, we were like, oh yeah, this is gonna be easy. We already have a successful SATO pan. We just need to put some sides on it and make it taller, and we'll be done. We realized how much more research we had to do into the actual ergonomics of this. So you can see the top of the stool, we've kind of modeled it after a traditional toilet seat, but we printed I'd say about 20 different versions of this, and went to Africa and had people sit on them and let them tell us what works, what they like. Kind of take a kind of an average or an aggregate of different types of physical bodies, shapes, ages, heights, weights, and then we kind of landed on this. This was the kind of the most comfortable for everyone across the board. Then we also incorporated, because in some areas, especially in Africa, where this was first initially launched, water scarcity is a real thing. So we incorporated this pull tab, so that if you don't have much water to use for flushing, if you want more of a dry style toilet or less water in your pit, you can just pull this and open the door and automatically release the cable that connects to the weight side of the door. So I think that's pretty much the gist of how the stool works and what the stool is all about. And then for the tap, I think we don't have one in our hands with us, but we have a video just showing you. Go. Hopefully this works. Okay, there we go. So the idea with the tap is it uses, let me just pull the picture again. So you can see it uses a standard 2-liter bottle, but any sort of PET bottle that you can that's there up to 2 liters, you can use that, and especially in some of these markets, you find them lying everywhere. So this will help kind of recycle this plastic waste, and they can fill it up with water, flip it upside down. There's no locking mechanism, so any sort of nozzle will fit into the base there. And the base itself is only 2 parts. You have what we call the soap base, as well as the teetering handle. And it's that simple. It's just 2 pieces that snap together. The water fills into the handle, but because in the closed position, because it's angled up, you have a little air pocket there, so the water will not come out until you teeter it down. And we designed this so that you can wash your hands with as little as 100 milliliters of water. So that helps promote these kind of water-saving initiatives. And as well, we've made it so that you can either mount it on a table, let's say at a food stall in India, or a table in a school in rural Africa. Or we have holes on the top that you can hang it from a tree branch or a limb, kind of like what they're used to with their, what they call like the tippy taps in different regions. But I think that's got everything for these 2 products that we're testing that we sent over to Guatemala.
Great.
Oh, okay.
Yeah, great, thanks. Thanks, Gunjan. Step 3, we spent a bit of time together in Guatemala. This was June of this year. This was months in the making, but a really special, important moment in the partnership. We were in the Antigua, Guatemala, which is very beautiful. If you haven't been there, I highly recommend it. But the intention was a full day workshop. Gunjan and Dago from our product innovation team came along, as well as Amit from our supply chain division, to go through a really intensive training for how to install the products, but also how to be prepared for the questions. How are we going to interview people? What are we going to say? We want to make sure we're doing it in a cohesive, strategic way with so many partners involved. Wanted, of course, to get to know each other, but also really prepare for roles and responsibilities, thinking through expected challenges. We agreed on the timeline, we agreed on deliverables. So a really kind of important moment in our relationship.
Hi, Annie, thanks. Before explaining this slide, I just want to give a little plug for the SATO tap. We've got one installed in our office's kitchen, and it works exactly as Gunjan said. It works really well, and you can wash your hands with almost no water. So a little shameless plug. IWASH had to learn about the local context in terms of rural community access to safe water and improved sanitation. We did that through an initial scoping evaluation prior to developing the program proposal, and then again through a more in-depth market study in year 2 of the program. IWASH works in a variety of contexts in urban, peri-urban, and rural communities. However, as you can see from the pictures, the need for improved sanitation is greatest in rural settings, where there's less access to an improved water source, lack of connection to sewer systems, and lower economic purchasing power. In these communities, as you can see, latrines tend to be self-constructed from fairly basic materials. These unimproved latrines are vectors for insects, diseases, odors, and cause issues around safety and protection. It's interesting to note that many of the communities in which we work, in which iWash is implemented, have a higher number of households that receive remittances, financial remittances from family members who have migrated to the United States. However, for many reasons, investment in improved sanitation facilities is not typically a priority for these households. They use their remittances more for improvements to housing, productive activities, or household consumption needs. If you could skip to next step 5. So because of this, there is a large potential untapped market for rural sanitation solutions that are easy to clean, that reduce disease vectors and odors, and are affordable. Also, there are logistical issues related to the cost of transporting larger and heavier porcelain or fiberglass latrines, but also make the SATO products an interesting alternative as a product for vendors who are interested in reaching these rural markets. So that's why, in order to test the consumer response to the SATO products, we launched the market trial in September. Next slide. As you can see, through the collaboration with LIXIL and other NGOs that Annie mentioned that are operating in the wash space in Guatemala, we're currently piloting the SATO latrine and hand washing products in the different departments of Guatemala in order to learn about consumer preferences and opinions around these products. So I think Annie will give you some ideas of the early findings from those studies in the next slide.
Yeah, thanks, Mark. And just to note also that the entire sample size is it's 600 households, so we have installed about 100 so far. So one quick slide before that. Jason warned me not to do this, but he also warned us not to do the trivia, so he's kind of the dad. He's the dad of the panel. But I just wanted to take a quick minute. I think we can spare a few quick minutes. If anybody has any burning questions about the process, the next slides are all about the early insights and early data. So if there's anything that really stands out, I don't want to spend too much time on Q&A, but just want to kind of check in with the audience against Jason's better judgment. Carlos.
Are you selling the products and for how much or not? Just giving them away? So it was not clear in the beginning.
Sorry, yeah, great question. We are not selling them at this point. We are piloting them. So understanding what communities respond to, what their preferences are, if these products resonate, and if they would become customers. So some of the questions and answers you'll see in the early insights are specifically about price points, what people think what would they cost, and what they would be willing to pay.
Can I?
Yeah.
One of the extraordinary things about working with SATO on this process is I was a little bit skeptical at first when they said, we're gonna come, we're gonna show people the products, and we're gonna invite them to criticize them. If they don't like it, we wanna know they don't like it. If they say, I'll never use this, and we will take that into consideration and consider making changes to our product line to adapt. And I don't know how many of you have had an experience of working with the private sector, but that's asking a lot of a business to say, your product is almost there, but I really need you to go back to the drawing board. And to have that kind of invitation posed, not only to the global community staff, but the others that we partner with to actually come together in that retreat style format and invite people to poke holes in the idea was something extraordinary because it was very genuine. The commitment to innovating a better product, not in a lab, but through interaction with users, was something that I had not experienced at that level. The kind of thought that went into the design to come up with a product that was almost irreducibly complex, the smallest number of moving parts, the lightest, the cheapest, and then to come to practitioners and say, yeah, but what do you not like about it? I thought was pretty extraordinary, and I can tell you that our staff and our partners responded very well to that because these were new products to them. And if you're wondering, what is the experience like to work with a large company, global company like LIXIL and SATO, I have been really pleasantly surprised.
That means a lot coming from Dad. Anything else? Yeah, I'll take one more.
Yeah, I was curious in the lead up to this, there was market research done about retailers, distributors, if this is all in relation to be direct to consumer, what kind of disruption there might be in local markets. Yeah, just curious about anything related to that. Sure.
Yeah, that's a little bit of the eyewash component too, as they're looking at local retailers and entrepreneurs and how that would impact there. They want to expand the market as well, so that's kind of their role in looking at that from a very local context. As you'll see in a few more slides, there is a plan for expanding that type of effort in the broader Latin America region.
I didn't know if Mark was going to jump in on this one or not, but I think our market context analysis is 160 pages long. So that was actually done as part of the eyewash implementation, which exposed the need for more low-cost products in the market even before SATO started the sort of market-oriented pilot.
Just one additional comment on that, Jason. I didn't hear all of the question, but I did hear a question around market disruption. And really what we're trying to do in this case is create a market that is unattended. I don't want to say that market doesn't exist because the demand is there, but the supply really isn't. Most of these communities are in the western highlands of Guatemala and are quite rural. If these people want to purchase an improved sanitation solution, they have to travel to a departmental capital, which of course requires mobilization costs. So there's not really a solution for a market yet, at least a supply. So I don't feel we'd be disrupting a market, we'd be extending and creating a new market. So, but again, as Jason and Annie mentioned, that's part of what we're investigating because we definitely don't want to cause any negative impacts to this intervention.
Great. Oh, one more and then we'll move on.
Yeah. While testing these equipments, the sanitation one, have you received any comment like connecting this sanitation equipment with the running water or with the water storage container or hygiene purpose? And also regarding the hand washing, have you received any comment with the responsibility for stand and also dredge the water that will be used, wastewater will be used after hand washing? Also, we know that we need to have equipments that are cheap. If you link these things will increase the cost of these.
Not yet, but we're only 3 weeks in. So the data that you're about to see is just kind of early stage, but the plan is for this can be complete by the end of the year. So certainly to capture and have a full report on all the feedback we received. Yeah. All right, let's get into the data a little bit. Just being mindful of time. So again, this is 4 weeks in, sample size of 107 households with the intention, installations are happening in real time with the plan of installing in a total of 600 households, with potentially some going to schools and other healthcare facilities as well, just as a small test. So out of the 107 households so far, 86 of them already had a latrine. 64% of the households say they have access to piped water. Out of the homes that do not have access to piped water, the average was to have to walk approximately 2 kilometers to retrieve their water source. These are very interesting statistics to LIXIL for obvious reasons, to understand more about the genetic makeup of existing latrines. So 44% are made primarily of wood, 23% out of cement, a confusing, I would say 20% is other right now, so still kind of TBD on kind of as the full installation report comes through, and 7% of some sort of plastic.
We have all sorts of theories about what the other is, but we'll see as things progress.
Yeah. Also, just noticing that there's sometimes a language barrier, so kind of working through some of the early kinks of the data here. And 50% or 54% of their household reported that they had the latrine for less than 3 years. So again, kind of interesting to LIXIL to say that 80% recognize the need for improving their latrine, and 47% report that they would be interested and curious and potentially looking to purchase a plastic toilet in the future. So that is great news for us. That's always the big question of ceramic versus plastic. I guess one thing to note is those questions were asked before seeing the SATO stool. So the question about plastic happens before actually seeing the plastic toilet. The majority of households say they like the way it looks. 82% in terms of when we ask them what the perceived benefits are to their families, 82% notice that it would be cleaner and more comfortable, while 18% say that they can recognize it would have health benefits for their family. And to Carlos's question here, kind of the really exciting information for us to take note of is how much do you think it would cost? 39%, and we offer them ranges. 39% of households thought the SATO stool would cost at retail $13 to $25, while 31% estimated a little bit higher than that, over $25. So just to give a kind of a reference, the SATO stool locally produced in Kenya retails for about $15. So that's actually great news for us. It's right on track for what we'd be looking for a retail price. Similar categories in terms of how much would you be willing to pay. 46% of households said they would be willing to pay that 13 to 25, while 39% said they'd be willing to pay less than that, 5 to 13, and 16% willing to pay over $25. So again, great news for SATO in that that's hitting our target market price. These next two slides are about the SATO tap hand washing solution. I'm trying to understand what's currently happening. 77% of households currently wash their hands in an outdoor concrete sink, and I think it was 5% say that they had a water tap at their home. When asked about the perceived benefits, 40% of households reported reduced sickness, 24% said they thought it would be very easy to use, which was appealing, and 20% noted the usage of far less water. And we asked what the customers or households rather thought that the SATO tap would cost. 27% reported between $3 and $6. About the same amount, about a quarter of respondents said between 7 and 9, 25% between 10 and 12, and 25% actually said more than 12. So again, kind of a framework, the SATO tap retails in locally manufactured Kenya, and I think it's $5 in Kenya and $3 in India. So again, that's great news for us. It's right on track for what we'd be looking for retail price. So, questions about what happens next, where we're in the process. As mentioned, we're early stage, but the intention of the market study is to be quite quick. We launched in September. We're looking for this to be concluded by September. Some people and even some partners have asked why so quickly, but this is the type of data that private sector is looking for, especially when we're trying to make decisions. As just the last bullet point here is that we are actively researching and exploring regionally based manufacturing in the region. So this is the type of data we're looking for with a quick turnaround. So the entire trial will be concluded by December with the full report and case study hopefully available early 2025 on global waters that I know everybody will read every word of. Next step for us, hopefully, late 2024 or early next year, to think about how this relates to the broader region. So we want to, think about partner landscape analysis, competitive analysis in the broader region. We've identified a few other countries would be interested in taking a closer look. Those include Honduras, Colombia, Peru, and Mexico to understand what other partners would be interesting for us to further explore. That includes distributors, importers, retailers, NGO partners, et cetera, for how we can really start looking to build the supply chain and business model. Working now with a number of our trusted partners, including UNICEF, IDE, Water for People, thinking about how we can get some, I would say, quick and dirty insights from other existing programming. So asking them to take some samples into the field, asking their staff to circulate a study or a questionnaire rather, to see if this type of feedback is resonating. And certainly analysis going much deeper to see how we can build this out. And mentioned earlier, our supply chain team is actively researching and thinking through how to develop regionally based manufacturing. Of course, that's everybody's big question. The feasibility of shipping from Tanzania or India is challenging, right? Big lessons learned from that experience, of course. So the ideal is a much locally based manufacturing. So, I think a lot of questions we get about that is a little bit of a chicken and egg. What do you do first? Do you set up local manufacturing? How do you research that? We're doing it at the same time. So questions back to you. Kind of opening up for Q&A. We're right on time, 2:30. What are your thoughts? What are your questions? How would you have done this differently? Go lightly on us on that one. And how does this compare with your other public-private partnerships, et cetera? So open up for, actually before questions, anything else from the panel that I've skipped over?
Can I throw you like sort of a softball? If someone is saying, we're starting a project next year, we would love to use these products, when is the best time to talk to SATO? What would be your response?
So we're actually not going to open it up to the audience. We'll just ask each other questions. Of course, the answer would be right away. That's the dream of PBL. And, we're working with USAID projects, but we're also working with other partners as well. These projects, looking back at the 2-year journey to get here, I've been processing it over the past few days. How does a 2-year timeline relate to most other examples? There's been times we're waiting for the shipment to arrive. It feels like you're going very slow, but other times to say, this is going really well. This is on a good timeline to get things moving from the initial call to installations in about 18 to 24 months. I think that's pretty aggressive timeline. So knowing that that's probably what it looks like when you start that conversation in year 2 of a 5-year project, it makes it all the harder. So we are in a great, in an ideal scenario, talking to partners as they're looking to develop these even project ideas to think through how we would kind of create this similar model. So. Did you have anything to add before we?
No, I think you covered it.
Okay, great. All right, questions? Yeah.
We want to take Chris the microphone.
Yeah.
So they can hear online.
Okay.
So does your market study assume that the rest of the infrastructure is already in place, the PIP, the superstructure slab? So we're not necessarily expanding access to improve sanitation necessarily?
Yeah, we only have one mic apparently, but no, it doesn't assume that. I don't know the breakdown offhand in terms of some partners are installing the entire latrine and some are retrofitting existing latrines. I don't know. Right now, I feel like it's 50-50, but I'm not sure that's going to remain 50-50 through the entire 600 households, but it depends on the partner, but we're doing both.
A follow-up question, I'll just let you repeat it on the mic, is are you working on the supply chain for that as well? Because I know that, that's part of it up there with superstructure materials, slab concrete providers and artisans that are capable of installing that.
Yeah. Okay, that's a lot for me to repeat.
Sorry.
Are you building the supply chain for the entire latrine system? Is that fair enough?
Effective, yeah.
Okay. TBD, I think that's where iWash and partners will certainly come into play. They are working on those components and thinking through, as we gather more data, who's taking that role and what does that look like as we approach the business model.
And I would just say, depending on your context, the question that we often find ourselves asking is, what does it take to take this existing latrine and, you know, equip it in a way to hygienically separate, you know, the users from contact with pathogens, with feces. And I think actually one of the great parts of the system is its modular nature. In many contexts, if you gave people the choice of buying a superstructure or being able to construct it, I think that construction is attractive. And particularly in remote locations, the transport of construction materials is an extremely high-cost component in latrine systems. The other thing is that when people are constructing their superstructure, they can, not only can it be DIY, it can be self-upgradable. What is the part that is preventing them from attaining improved sanitation? It's that hygienic separation. It's having that valve that allows for a pore flush system with a very small amount of water, a cleanable pan. And, but I think when it comes to innovations around slab materials and things of that nature, that's the place where context by context, we have to work on a lot more innovation. You know, what is like really the lowest cost point to get to that entry level improved sanitation? And this is an element of it, I think.
Thanks for your presentation and discussion. I wonder, so we saw that there is actually a series of SATO product, right, including the V-Trap, which is actually a back-end system that enables safely managed sanitation, versus these are the front-end solutions. So I wonder if you guys have actually pushed forward in the communities when you're doing the market assessment to have this component of back-end system that promotes safely managed sanitation. So that goes a little bit counterintuitive to all the household customers, because they probably would choose something that they can see with their eyes, versus like if they don't have awareness of the importance of back-end system, then they probably wouldn't be choosing that. So I wonder if that's also a component when you're considering your systems.
What?
You got it?
Sure. Let's see. I know you didn't mean anything by it, but we certainly don't want to like push anything. So we spent a lot of time with the iWash team letting them drive the conversation. What do they think the communities need? They're technical experts as well. It's really trying to think through the local context and what that looks like and what products resonate. One conversation we were having earlier today was that before we met in June, there was a lot of conversation similarly with iWash and local partners asking, it was almost like a little bit, it felt gossipy maybe, that they were hearing from other organizations, we need an adapter. What is this adapter what's that product gonna look like? And they were very concerned and sort of alarmed, like we've heard we need an adapter, what is that? We need, how are we gonna ship it and things of that nature. So we spent a lot of time on this conversation. We were together in June, identifying the real source of that question and what it was, and realized that we didn't actually need that in a local context, at least not for now, in the communities they'd be serving. So I think all of these will come to light in terms of at the end of the trial, like, are there issues, if you will, with the actual latrines and structures that would need a different support service, kind of the underground support, but yeah, the iWash team determined that they didn't think that was relevant. Anything else?
Yeah, I can add a little bit. So just to add a little bit, so whenever we kind of show our products, or at least in this specific case, when we went down to Guatemala to have a product showcase, we bring a little bit of each system that we have. So it's a pan, stool, the I-trap, V-trap, pit liners, slabs. So we bring a little bit of everything so they get a taste of everything. And then we let them, like Annie said, we let them kind of dictate to us what they feel is the best to try out in those regions. So yeah, like Annie said, we try not to kind of force anything on them. We explain in detail the benefits of everything, benefits of having a twin pit system over direct pit or single pit. But we kind of let them, with our guidance, let them kind of decide what they feel is, at least for this trial, what's the perfect route to go with.
Ganja, could you mention the actual number of products that have been part of the SATO catalog? Because this sort of blew my mind.
So when we talk about individual, but unique products and systems, we have about 30 products. And then in terms of variations or iterations, different SKUs, we have a little bit over 60 products. So 30, like when I say unique products, so the pan would be one, a stool will be another one. So in terms of unique individual latrines or connection systems or slabs, we have 30 unique products, or around 30 unique products.
Thank you. Pretty unique partnership, being as USAID working with a private entity this closely. There's probably a lot of questions about that. But I'm curious, if it wasn't for this program that SATO had gone into Guatemala, would it just kind of, if you think about your natural market expansion. And then maybe secondly, about this market study, what's different because you're working with USAID that wouldn't have had their uniqueness as opposed to just doing this on your own business development?
Can you guys help me remember the first question? What, were you gonna go in Guatemala already, right? Yeah.
And also like, so, correct me if I'm wrong there, but what I understood is versus going in as SATO, going directly and doing, exploring the market on your own, what does working through USA funded program bring, and how might it look different if you were going straight to the market? Is that close, Seth?
I think that's one of them, but the other one would be from the beginning. Was it you want to go into Guatemala with the USAID?
Oh, yeah.
The whole aspect of like USAID funding sort of a private enterprise.
Right.
Is remarkable in a lot of ways. At least I think it's, happens all over the place in different contexts. So I think it's kind of an important question.
Yeah, I mean, I would reply that LIXIL has had a long-standing curiosity about the region at large. As mentioned, we've shipped a few thousand units here and there for humanitarian disaster response, something kind of a one-off without a lot of tracking and not a lot of knowledge as to where they went or the usage and performance. So that, but limited capacity, we don't have any staff in Central America. So noticing the overlap between new markets or relatively new markets with USAID priority WASH countries. Guatemala is one of the 2 WASH priority countries in Central America. Haiti is the only other USAID WASH priority country right now. So that enabled us to access working in close collaboration with the USAID project there. So certainly they opened the doors for how we would do this type of market study. We're able to use PBL, resources to fund this effort, knowing that we'd be supporting both LIXIL and USAID's initiatives. I mean, and in terms of how it would look differently if we were doing it on our own, our market trials, I mean, we have them on our own. In other countries, it's just far more limited, to have an existing staff of IWASH. How many people work at IWASH?
A lot.
100? I don't know. Sorry, we didn't prepare that question. But I mean, it's a sizable team to say this is amazing access for us to be able to tap into this and work with so many partners, and for them to work on our behalf to recruit even further partners to test. IWASH is working in 2 departments in Western Guatemala. The other partners they've identified have helped open up those other 2 departments. So we're testing in 4 departments in total.
Another element of working with IWASH is, IWASH is a new partners initiative program, which means the global community is only implementing through local partners, local government, and regional government. And those existing relationships are extremely important. I believe and this, this is an impression that already being a trusted partner of government and local organizations led to a meaningful introduction to some of those local partners. It is sometimes not easy for our local partners to wrap their heads around all the complexities of working with the private sector. I can tell you that even the importation of the samples alone was an administrative task, a substantial administrative task. The other thing is because as a project, we're tied into the network of WASH implementers, of course, we invited all of our friends to see the products, to ask their questions. Finally, I would say, market penetration for any business is an expensive and uncertain thing, especially if you're going into markets that require demand creation. And I know that to the pure market people, that may be a bad term, but the truth is, not only do we have to expose people to the products that for health and dignity purposes, we would like to see them using, but we have to promote the benefits of them as well. And in underdeveloped markets, that's something largely done by implementing partners and our government and CSO collaborators. So, I think we provided a network. It would be the short answer of connections, of trusted connections.
Thank you, thanks very much. Could you just run through what some of the lessons have been learned throughout this course and the project is about?
Gunjan is our surprise game show host and now Asha. Does anybody else want to start before I? Gunjan, anything?
For lessons learned?
Yeah, you first.
Yeah, I'll use this.
Oh, yeah.
I think primarily the lessons learned, at least, I'll speak more on the technical engineering side. Maybe I should say the product side. When we first went there, like Annie and Jason were saying, they had no idea about our products. So kind of, conceitedly, that surprised me a little bit. But understandably, we don't have a presence, on this side of the world. So, over time I understood that. But their interest, once we started talking about the products, everyone's interest kind of really excited me again. They're asking really good questions about, how the different systems work. They just started taking everything apart and wanted to look inside of it. So it was good as an engineer, at least, to kind of show them the ropes of how everything works inside of some of our systems. So that really kind of reinvigorated me in terms of, and surprised me in terms of, starting this research with them.
Okay, I'll go next. A few that jump out for me is that, as kind of referenced earlier, the 2-year timeline is, I think, a fair expectation for launching something of this effort. So I think sometimes we do set unrealistic expectations for ourselves to get something like this off the ground, but I think 18 to 24 months is a fair and somewhat aggressive timeline. I think secondly, importing and shipping is hard. So to have patience with that first trial run, knowing this is the first time any of us have attempted to ship something from Tanzania to Guatemala. So recognizing and understanding there will be bumps in the road, and we'll consider it a learning experience and kind of go from there. And I guess maybe last is just, there was a few, we were feeling crunch time to get some things up and running for this conference, as installations just began a few weeks ago. And all of our conversations with the iWash team, we speak weekly. And we have a translator, since I unfortunately gave up my high school Spanish. And the translator told me at one point, it's not helping that you're being pushy. And at first I was defensive and I got a little, I was a little irritable maybe, but then I thought maybe that's a pretty great sign that the time in Guatemala together was time well spent, because culturally that's pretty hard for them to share with us, to say that's actually a pretty great moment, that they can let me know that something's uncomfortable. Private sector, we want to be very careful of that. We won't want to be pushy on NGO and other implementing partners. So, kind of tried to turn it around into a positive moment, but really kind of applaud the partnership that we feel comfortable enough to share those insights with each other.
We got an incredible number of great comments and insight as we met with so we sort of had this conference style gathering of a lot of different partners and stakeholders, government, UNICEF, implementers, CSO. And one of the things that probably shouldn't have surprised me is that product acceptability isn't just about what the customer wants, that different implementers and different stakeholders have different priorities for the products based on their approach to promoting or distributing them. And just to give an example of what I mean, one partner may say, oh, we only do full latrine installations. We don't do upgrades. Another partner may say, we only work through subsidy. Another partner say, well, we only do, direct sale, or we only work through vendors or wholesalers, or 1,000 other variables. And I think the idea, if I had it, that you could show up in a market with a product and there would be a one-size-fits-all system, and that the market would just take care of that, is not realistic, because we don't have strict, pure market conditions. There are all sorts of things influencing where the products go, how they're used, how they're installed, the conditions under which they're sold. And I think that is why that stakeholder engagement is so important, because you could very well be in a situation, we've probably all experienced what happens when you're trying to use one approach and somebody comes into the same geography, has got a totally different approach, and suddenly, you're what you're trying to do is sunk. But I think the better approach is, in the very early stage, before the product is individually available to purchasers or partners, is to actually come together and say, we actually need to think about a unified strategy. If we think this is a good product, if we think this could provide a dramatic sea change to the landscape here, maybe we do need to talk about how the implementing partners are going to collaborate together, and how we're not going to shoot each other in the foot. And I think that's also one of the roles that we have our trusted group of implementers and local partners, is to say, we can ask that of colleagues that trust us and work with us. It's not easy for the private sector to ask that of an implementer, because the trust isn't there yet. It's just not there yet.
There's a question.
Sorry.
That's it.
You said the question?
Je ne sais pas si quelqu'un parle français ici.
Oui, vas-y.
Vous parlez français?
Oui.
Ah d'accord, je suis du secteur privé. Je viens de l'Afrique de l'Ouest, un pays qui s'appelle la Guinée.
Sorry, let me start with you. So, and sorry, comment vous appelez-vous?
Je m'appelle Alimatu Diallo.
I can't say what you just said in your name, but she comes from the private sector, coming from West Africa.
Ma question c'était de savoir quel mécanisme vous mettez en place pour soutenir le secteur privé, en étant secteur privé. Parce que j'ai vu ces solutions pour la première fois en Ouganda, où j'ai participé participé au congrès de l'Association africaine de l'eau et de l'assainissement en 2020. Quand j'ai vu ces produits, je me suis dit que c'est intéressant. C'est une solution pour mon pays, parce que je sais que la problématique, elle existe. Et depuis 2020, je me suis intéressée personnellement sans soutien. J'ai essayé de contacter vos membres qui sont en Afrique. J'ai réussi à importer une grande quantité dans mon pays, une quantité environnant les 2000 sans soutien. Et là, je m'efforce à intéresser toutes les parties prenantes, parce qu'en tant que secteur privé, je ne peux pas impacter ceux. Donc ma question, c'était de savoir quel est le mécanisme que vous mettez en place pour soutenir le secteur privé, pour que tout le monde puisse, et pour que le produit puisse s'élargir, et qu'il y ait assez d'impact dans les différents pays.
Okay, so the question is during this process, what is the mechanism for supporting the private sector, working with the private sector to assure that the products are available and that there is a competitive market in place? Because, you know, she originally saw these products in Uganda and then took it upon herself returning to West Africa to, you know, to look at the importation of the products. But the question is really, you know, how do you work with the existing private sector that's in place to make sure that you're working together?
Can we ask Mark? I wonder if Mark wants to take that question.
Yeah, sure thing. Well, the first thing we did was, I think I alluded to it briefly, was a market study. So we did a water and sanitation market study, which is a very in-depth study, 6 to 7 months from beginning to end, that sat down with focus groups of the private sector, distributors, producers, manufacturers, water and sanitation players, both in the government and municipalities. And that really informed the design of our objective for and private sector market approach. From there, we have formed regional roundtables with the private sector. So we wanted to make sure that on a regular basis, we have a space where we can meet with the private sector to discuss some of our activities and priorities, to make sure we're not just inventing these in a bubble, but that it comes from a dialogue with the private sector. So just one last comment, Jason, and then you can translate. To steal one of USAID's favorite words, it really was a co-creation process from day one with the private sector. So that was to make sure that we're not developing something that won't be useful or won't promote private sector involvement, engaging them from day one in co-creation processes.
Parce que l'une des difficultés majeures, c'est l'accessibilité avec les ONG. Les ONG, difficilement nous accédons au niveau des ONG, et difficilement ils acceptent les solutions. Maintenant, vu que nous utilisons vos produits et nous sommes en train de promouvoir vos produits, normalement, derrière, essayer de réfléchir quel est le mécanisme le plus adapté pour nous soutenir vis-à-vis de ces ONG pour qu'ils puissent nous accepter et nous soutenir. Parce que nous investissons en tout ça.
Donc, si j'ai compris, vous demandez quel est le... C'est une question d'accessibilité du secteur privé aux ONG. Par exemple, si vous avez quelque chose à offrir, comment accéder au marché représenté par les ONG, c'est ça?
Oui, pas quelque chose à offrir, mais ce que j'ai à offrir, c'est les produits SATO.
Ok.
C'est le SATO que j'ai chauffé dans mon pays, c'est le SATO que j'ai importé dans mon pays. Donc c'est le SATO que je suis en train de promouvoir.
Okay. So if I understand correctly, the question, you know, speaking from the perspective of the existing private sector, you know, you have NGOs coming in, and how do we create a situation when instead of, if I understand correctly, instead of from buying, you know, SATO in Tanzania, that maybe the NGO or government partner would be going to the local private sector to actually make those purchases so that the local market is sustained, I think.
Yeah. Do you want to? Yeah, I mean, certainly you're describing the ideal scenario. So that's how we're working with these partner landscape analysis and competitive analysis to really understand the best way forward. So let's assume the market study provides great results saying that yes, everybody wants to buy one. Step two is really identifying those partners, retailers, importers, distributors, really to make sure that these products are aspirational and affordable, but also very locally available. So making sure that that supply chain is in existence far after IWASH project ends.
And I can speak to one aspect of that. When the market study was done, so this is before the SATO pilot, a large part of the market study was identifying local vendors, wholesalers, producers, because it's in no one's interest to replace the local market, but to support it and work through it, especially since these are the retailers, the vendors that have penetration, hopefully, in the areas that we want to reach. Now, I'll be honest, in some of those rural areas, the big question is who could serve to be that vendor? And what work would need to be done to work with a business to stock, sell, and support these products. And that's not always an easy answer because they may not be in existence. So that's where the capacity building of the private sector partners come in. And sometimes we're in a situation where we're taking the product and we're going to that local, for example, hardware vendor that sells general building supplies and says, have you seen this product? We have information as an implementer that there are a number of households that are interested in it. Would you be willing to stock this product with a reasonable markup for so that you can make a profit, but also with the agreement that you need to support it and that you need to connect with local artisans, for example, that can install it. So that sometimes the value chain and the supply chain does not exist yet. Or it may be so fragmented that it needs an intermediary to come and connect those pieces together. And again, going back to this idea of demand creation, as implementing partners, we do have a powerful thing to offer, is we're going into communities and say, how many people have a latrine? And if it's 20%, we start talking about the health impact of lack of improved sanitation. People say, you know what? I think I'd like to buy a latrine. Where can I buy it? And if we don't have an answer for that, we're already stuck. So it is absolutely in our interest to work with existing private sector, but also to help them in identifying gaps in the supply chain and gaps in capacity as well, because we also serve as an intermediary in the sense that we want the international supplier, if that's the case, to have fair, equitable dealings with that local business. We in some ways represent the local community. They're our staff, they're our partners. So, I think we have a role to play there, even in advocacy, to make sure that markets develop equitably, that the access, those hard to access areas aren't, left out.
And just one quick note that PBL, Partnership for Better Living, fills that role as much as possible. I mean, one of my colleagues just got back from visiting 3 countries in Africa it's almost the next phase for where we could go beyond this partner landscape analysis to say, okay, these local distributors have been identified. She went in and said, okay, let's think about how we could co-create a marketing campaign. What materials do you need? What locally based installation guides do you need? Like, what other support do you need from us? How can we button up the supply chain so you know who to ask, either from within PBL or the SATO team at large for where we can get those types of resources and support. I see it's 2:59, so does anybody have one last question?
Two really quick questions. Mine follows on really well to that last question, which was, does LIXIL set like a recommended retail price? Like, how do you work then with the private sector in setting a price that's fair? And then one solution for manufacturing could be to just make a bunch in a place where you can make cheap, very low cost components and ship around the world versus do it regionally. What role does LIXIL then play in the supply chain in terms of quality control? You're making sure that all these different places where you're making your product, that you're getting more product out of all these locations. I can start off with this.
Can I add just a sub-question to that?
Oh, maybe I should.
No, I just sort of related to that. I was wondering if you could speak to a little bit more on your price point, and the willingness to pay component under the study, and just the differences in asking what somebody will pay versus asking them to give you cash on hand.
So just first off, just to start off on your supply chain quality control question. So we do have a supply chain and quality control team who are kind of the main liaisons between technical side or the engineering team and the manufacturing side, the local manufacturers, depending on which region we're talking about. So there is a constant kind of between all parties. So if there's any sort of issue, that's not just stopping from manufacturing, it's going to the sales teams, local masons or hardware stores, or wherever these products are. So there's a big kind of linear progression through this chain about if there's any issues, it kind of works up the process, and then if it's a kind of a dire or a big enough issue where it needs to we need to take a look at it on the engineering side, then we kind of look at it and see how much of a big change or tooling change or whatever kind of change we need to make. Otherwise, then it kind of stays with the quality team and manufacturing side, see if they can kind of fix what the issue is. So there is kind of a system in place. It's more of a progressive system depending on how severe the quality issue is. Okay, thanks. And then, Ken?
I would just say that Guatemala is a rather unusual example in the fact that we have no staff, we have no locally based staff. We are, at the scratching the surface to understand if that would end up becoming the case, and fingers crossed it is, right? But that would be the role of, SATO Guatemala team to say, let's identify these retailers, the distributors, the manufacturing, et cetera, and really work on those, establishing the supply chain metrics, the business model, thinking through the retail price, how are we gonna work together, what's the royalty structure, things of that nature. So that is all sort of forthcoming, but certainly would be the role of how we want to turn over to kind of a country level staff member, if that answers the question. I just wanna say, sorry, hold your applause. Thank you so much for coming. Really enjoyed this conversation, and I think the majority of us will be around tomorrow as well, so feel free to grab us if anything else you'd like to ask any further questions, but thanks so much.
That's what you guys I'm good. Good, how are you?
Look. Obviously, they have to design it for kids as well, right? Is that the idea?
Yeah, there's a solid one actually, there's a higher school too.
Okay, I was just thinking about my knees.
Oh, that's 16. Not that you're 16, but
This is our initial size, height, instead of
Good job. So question. No, not butt. I didn't mean the butt. I meant butt. So it's really
they're like, we're gonna have some things, these are some things that should be done on the leash where they can go off. Alright, let's see if we can
Prices are shared because of the question of how much research you guys done. I just thinking from a structural perspective, I assume this just gets kind of bordered into place, or is it concrete band?
Yes.
Do you get more stress on this and fracturing or whatever the order is coming out?